My name is Deanna. I am your representative with Arthrex. Thank you all for coming in today. First and foremost, I really appreciate all your time. I know that it is extremely hard to take your time away from seeing all of your patients, so I just really wanted to thank you, and I know that Natalie feels the same way. So without further ado, I'm going to go ahead and hop right into it. Today we're going to be talking about a DBM. Our specific DBM to Arthrex that we're talking about today is called Arthrocell. Now, Arthrocell is a little bit different than what I'm sure that you guys are used to dealing with. Typically, DBMs are acellular. You would have to eventually graft some bone marrow or some PRP to add that osteogenetic portion to your composite scaffold. Now, what we have are all three factors or mechanisms that are necessary in bone healing. Just to kind of go over and brief that quickly, you need osteoinductivity, osteoconductivity, and osteogenetic factors in order to expedite that process of bone healing. Now, our product does have all three. I'm going to kind of dive a little bit deeper into that. But first, I do have a sample of our product that I can kind of show you and give you guys a visual aid of what it's going to look like. And I'll go through and in depth of all of those factors. So number one, you have your osteoconductive portion here, and this is the cancellous, and it's a microparticulate bone blend of cancellous and cortical bone. So that's here together, and this will contain your osteoinductive factors as well as your osteoconductive factors. The osteoinductivity that is part of this bone is in the growth factors as well as the BMPs. Now, you actually have an osteogenetic factor to this kit as well. Now, we have actually harvested stem cells from human vertebra. These stem cells that are contained in this vial consist of MSCs, osteoprogenitor cells, as well as Miami cells, which are kind of a new innovation into this industry. I'm going to touch on that a little bit more, and we're going to go a lot further in depth in Miami cells, but I just want to explain this product to you quickly. But it's a really, really cool innovation that I really do want to dive into. Now, you're going to take your scaffold, your powdered scaffold, and take your genes here, or I'm sorry, your stem cells, put them into the scaffolds, let that sit for 10 minutes, and then you also have this gel. This gel is going to work as basically the glue to keep these components together. This carrier is made out of a type 1 collagen. So you're going to take this gel. It comes in a little container where you can actually slice the gel into 4 different pieces. You're going to stick it inside of your syringe, which I have misplaced, but this is going to be our syringe.
Improv. You can just use that one.
Right there.
Oh, this syringe. Okay. You're going to stick your gel that you've cut already into 4 different pieces inside of your syringe and blend that up. And once you've done that, you're going to stick it inside of those 2 different components that you've already mixed together with a freer elevator, and go ahead and do that. Mix it together until it's in like a moldable putty-like form. So that's kind of the little rundown about how you would put that together. Really quickly, go ahead and take out the handout that I've passed out to you guys. It has Arthrex, Arthrocell there at the top. And I've kind of already touched on the mechanisms of bone healing in that top portion. But what I really want to touch on now is the key standout features that really differentiates Arthrocell from other BMPs that are on, I'm sorry, not BMPs, other DBMs that are on the market. So I'd already mentioned that Arthrocell is a cellular bone graft. Okay. I'll write that down for you. Now, the cellular bone graft really does give you the advantage because it's already pre-mixed for you. You don't have to do that second incision site or graft that bone marrow PRP yourself. So that does save you time, which I'm sure is a huge, huge benefit to you guys. You can spend your time better in another surgery, maybe in the clinic with your patients. Anything that we can do to save you guys time is definitely one of our number one goals here. Now, secondly, this is huge. There's actually no adverse effects that have been discovered so far with over 25,000 units plus that have been distributed in the United States with the bone grafting itself. And thirdly, this is also super important, the cryoprotectant that is used to preserve those stem cells is DMSO free. Now, is anybody familiar with what DMSO is? Or why it's not very good to use it? Sure.
After the cryopreservative graphics then being thawed out, that can actually be harmful to the actual.
Exactly. So DMSO is toxic to human cells. That's the reason why we have to decant a lot of DBMs that are currently on the market. We have to get that DMSO out before it actually kills those cells. Now, with our cryoprotectant, I'll write that down for you, it's DMSO free. You won't have to decant the product, which will also save you time.
Time is money.
Yeah.
And we have studies that we've done on our own that proves that our cryoprotectant is superior in that it actually preserves the viability of over 85% of these cells. So that really helps out because our number one goal here is patient advocacy as doctors. Now, in order to be that patient advocate, we want the best absolute solution for our patients. And we're going to get that because we have the predictability of knowing what we're going to get with these surgeries, or at least having a better understanding of where our end goal is going to be. Whereas with other DBMs, you don't really have that ability. Now, some disadvantages to the product are it does only come in two different sizes. We have a 2.5 cc, and we also have a 5 cc size. And then sterilization, sometimes it's just simply doctor preference. We do have to send these tissues off to a sterilization site, and we actually our distributor is Vivex Biomedical. This company does aseptically process our allograft, and sometimes that can be interpreted as a possible contamination of the allograft itself.
They have a good reputation in the industry.
They absolutely do. Yeah. So that's kind of our end key standout features there. It does have a 2-year shelf life. It does have the superior handling characteristics of a DBM that you're probably used to. It's really easy to use. It's moldable. You can actually use it in a lot of different kinds of surgeries regarding bone defects or bone remodeling. The typical ones that we really see are in the calcaneus fractures, clavicle fractures, spinal fusion, et cetera, et cetera. So that's that. I do want to touch on Miami cells like I promised that I was going to. So this is a study that shows men and women between the age of 3 and 72 that their stem cells were isolated in these cultures in the lab. The cultures were put into environments that resembled an in vivo environment. Now, Miami cells are a little bit different than different stem cells that we're typically used to or we know about. Now, Miami cells are able to differentiate into bone-forming osteoblasts, cartilage-forming chondrocytes, fat-forming adipocytes, and neural cells. And they do this extremely well. Now, this study was a marrow-isolated adult multilineage inducible Miami cells, where a unique population of postnatal young and old human cells with extensive expansion differentiation potential was found. Now, basically, this is just saying that adding the Miami cells to your DBM increases the productivity of osteogenic cells like osteoblasts, and that'll lead to bone formation and an expedited healing process. So there's really no downside of adding these Miami cells. It's really only an upside. Yeah, so that's basically a conclusion of our product. Does anybody have any questions regarding anything that I've gone over?
So how long after thawing do you have, the time window before the DMSO starts to degrade the cells? Is it immediate? Or
Well,
do you have
the DMSO doesn't degrade the cells at all. It is non-toxic. So you do have a 4-hour window, right, that you are able to use the product in. But yeah, like I said, I don't want to confuse anybody. Our cryoprotectant is completely different than what we've seen before. Yeah, it doesn't degrade those cells at all. It's not toxic. Okay, we don't even decant it. We don't take it out. Okay, so yeah, it can be what's the word I'm looking for? Metabolized through the body. Okay. Any other questions?
All right.
Well, you know, when was your product HCT approved?
Yeah, so it actually is approved under a 510K.
It's a 510K.
The stem cells itself were approved under the HCT / P regulation process. But yeah, we were approved last year for our scaffold.
Any other questions before I jump right in? All right.